Hey, this is Dr. Hunter. This is just a disclaimer. None of the information I give out is any personal medical advice. If you have any personal medical advice that you need, please seek out your regular provider. Hello. This is Dr. Hunter with Mentor Moments, Growing Beyond Failure. Thanks again for coming back. Please like, subscribe, share on all the different platforms. And please just reach out and ask questions as we go along. Today's episode, we're going to be talking about how do I advocate for myself or for a loved one? And how do you become a good advocate for those you love the most? This is not a podcast or video trying to bash anybody at all. What I want to do is more figure out ways to uplift and figure out ways how to partner with those taking care of you or taking care of your loved ones. The number one thing I want you to know is that to be an advocate for someone does not mean you have to be combative. I think the combative nature is what has been tied to the name advocacy and advocating for myself or advocating for my family. And I think that that's not the right way to go. That's not the right take to have on it. So you would never be combative if you were trying to be an advocate for Boys and Girls Club or an advocate for a small town restaurant, trying to help them recruit more people to come to their restaurant. You would never be compatible with it. Like, the goal is not to say you're doing it all wrong, do it like this. I can't believe you would make that decision. Like, that's not how you foster and cultivate great relationships. Good advocacy fosters marvelous and fantastic relationships to where it builds trust, and that's all it's about. Advocacy is about trusting an individual, trusting a group or a group of people to get a certain outcome or a job done. So what I want to do is go into some very specifics on how good advocacy happens and what it looks like, and then what steps you can take to be a great advocate for either yourself or for your family. Some really good examples of good advocates are doulas, okay? In the obstetric community, doulas get a bad rap because there are great doulas and there are bad ones, just like there are great doctors and there are bad ones. And the key thing to know is that doulas are supposed to be these ultimate advocates for the pregnant mom, the postpartum mom, and for their family. Their goal is to help support mom in whatever decision she wants to make, and then help her sort of stay within the confines of the plan that she had set forth before either delivery or in her postpartum setting. There's a lot of good data on doulas and how they really actually help maternity care. If you look at, there's some major journals, but one of the big journals in OBGYN is called the Journal of Obstetrics and Gynecology. It's called the Gray Journal. And in the Gray Journal, there was an article that was put out, and basically they talked about doula care and how it helped improve morbidity and mortality. If you look at just numbers themselves, okay, in part of this study, they looked at what happened and what are some of the positive outcomes from having a doula. They looked at, for every 100 patients, those that had a doula had a 15 to 34 more vaginal deliveries out of every 100 versus a C-section. Then, on top of that, there were 5 to 6 more patients that attended their postpartum visits. And then on top of that, when you talk about, that's just mom, now we talk about baby. On top of that, infants were 20% more likely to be exclusively breastfed. And we can go in later on and talk about the positives of breastfeeding. No, I am not a pediatrician, but there is good data to support that. And I have to know at least a little because of my job and taking care of women of all stages of life. And then the last piece in that same study also talked about that there was a 3 to 4 fewer preterm births per 100 deliveries. And those are really big key pieces in maternity care and taking care of moms. More vaginal deliveries, attending more of your postpartum visits, babies breastfeeding exclusively, and lowering the preterm birth rate. So that's just one, doulas by themselves. And we're going to come back and swing back around to doulas because I think they serve as a great example of how to truly advocate for oneself. But another way to advocating for yourself is attaining knowledge. And one way that a group has figured out how to do that and provide patients the ability to attain knowledge without just sitting in front of a computer and Googling everything is to change the way we provide prenatal care. There's this group prenatal care method called centering pregnancy. I was involved a lot in this when I was a medical student, and essentially what the goal of the group is and how the context of how it's set up is that there's a group of 8 to 10 pregnant women who are roughly due at around the same time. And instead of going to a regular prenatal visit like you would, you show up at your visits at your appointments at 9:30, you show up at 9:20 because you're really good, you show up early. And you get there, you see your whoever provider, your nurse practitioner, your PA, your midwife, your doctor, whoever you're seeing. You guys talk for a few minutes. They listen to the baby's heart rate, measure your belly, and then kind of go about your way. Instead of doing that, and that's it, what you do is you come into this group, and it's a 2-hour appointment. So 8 to 10 people, 2-hour appointment. And what you do is every mom comes in, they take their own blood pressure, they take their own weight, they jot it down in their chart. Then they go and see the lead provider that's there for that room, and they sit down and you listen to all the babies, you measure all the bellies, and then you ask whatever question you may ask, but the answer is not given. So you may say, when am I supposed to start feeling my baby move? They don't give you the answer yet. You sit down in a group and you talk about answers to the questions that you've asked and some main topic: birth control, breastfeeding, ultimately, what is a C-section? What does a vaginal delivery look like? What does an induction look like? There are different topics for each for each visit, and you talk about it as a group. And the goal is that the main provider there, the midwife or doctor or NP that leads that group, is not doing all the talking. It's all the other women in the group doing the talking. So you gain knowledge not only from the provider, but also other pregnant women who are either a little bit further along than you, have experienced something where you're like, shoot, I experienced that too. Or just like the culmination, you're kind of learning together. And that is a way to advocate for yourself, because now knowledge is power, right? So now you have this knowledge base of how to, what to expect. And sometimes if you get a better idea of what to expect, then you can advocate for yourself, because if something is going awry and it's not as what you had been taught and what you know, then you can ask more questions. The questions are always better when you have a better understanding of the topic at hand. And so that's the biggie. And so that's why centering pregnancy is another way to help you advocate. Very specifically, though, when it comes to advocating and what that means and how do you do it sort of on a specific basis, because I'm talking more generalized here, the key thing to know, and I think what we've gotten wrong, is we have told people that you have to have this checklist, right? You have to have this birth plan that tells your provider exactly what you want when it comes to delivery. The problem is the birth plan is a very one-sided event. It's a very one-sided paper. What you are writing, and someone has created this generic topic or this template for this birth plan, you put it in there and you're saying yes, yes, no, 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 yes, 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 no. The problem is everything on that birth plan does not always align with what a hospital or what a group stands for. For instance, every hospital I have worked for, it has always been a rule that if you do not want an IV or are declining an IV, then you cannot deliver there, because we cannot help save you if you don't have an IV. And that's just the hospital stance. That was the practice's stance. That's just where I am. You have to have an IV. We're not saying it has to be hooked up to anything, but you've got to have an IV because it's a very life-saving step in taking care of pregnant women. So, but there are birth plans where it says, I don't want an IV. Well, here's the thing. If you don't want an IV and you stand very strongly and very firmly on that, then what you have to do is then seek out a place that allows that to happen. But it's really not great to have this combative nature to say, no, you will not put an IV in me, when now you're battling a bigger issue, where now you're battling a hospital system or a big group where this is their practice, right? This is not a one-sided event. You have your wants, your wishes and wants, and we have ours too. Now, ours is a little bit different than yours, right? We want the best for you. We want a safe delivery. We want a safe and healthy baby. Like, that's our goal always when we deliver moms. But sometimes there are steps that we say you must have because we feel like that's the best way for us to give you that care. There are other ways to do it where you don't have to have an IV. Some birthing centers tell you don't have to have one. Some home birth providers tell you don't have to have one, and that's fine. But that's where, the birth plan doesn't always work that way, because I think a birth plan creates a combative nature to care. It doesn't allow you to understand the other side of what is expected. But I do think a birth plan does help to create more dialogue and questions. Like, hey, do I have to have an IV when I'm on labor and delivery, right? So instead of just saying, don't want it, you ask the question, hey, is this a hard, fast rule, or is it negotiable? And then now it's a different type of conversation you're having, because if it's a non-negotiable, now you know there is no fight. You don't have to say, no, no, I can't believe you would do this to me. You just say, okay, cool. It's just like buying a car. If you have very specifics in your head things that you want, or you have questions about things that you can get in a car, and a car salesman tells you, no, you can't have that, and you're like, well, that's a deal breaker, then you just leave, right? There is no skin in the game. You're like, peace out, bye. The problem is, in pregnancy, insurance doesn't love when you hop around to different providers. So that's why it's kind of a good idea to, if you know that you want very specific things when it comes to delivery, to try to ask those questions very early on to see, those non-negotiables, who is going to help you through that, or others who are saying, absolutely not, sorry, we can't help you. And that's okay. And it's totally okay for someone to say, no, I'm sorry, we can't help you. Because ultimately, to be an advocate for yourself, the goal in all of this is you want fantastic outcomes, right? You're trying to say, I want to be able to have these things, this type of care, because I feel as though if I get these things, then my outcome will be great, right? So that's what being an advocate for yourself is. And to do such a thing, you need more knowledge. Well, here comes step 2. You need to be able to trust your provider to help you gain said knowledge, right? You need to have a group, a provider, a person that you not only rely on, but has information that can share information with you that you feel like you can trust. And if you don't feel like you can trust your provider, there's no way you can do a great job of advocating for yourself, because you won't have the basic knowledge to be able to speak up and say, hey, I think something's wrong. Hey, I don't know if I like this. It's easier to tell your sibling if they're doing wrong than it is to tell a stranger that they're doing wrong, right? Because you know that sibling, you trust them. It's easier to tell a loved one that, hey, you're not doing this right, than it is to tell a stranger or someone you don't know or someone you fear that you're not doing something right. When you go into a situation where you, for instance, show up to a hospital to deliver a baby in a place you've never been to before, with providers you've never talked to before, and you don't know any of the people or any of the names, there's an innate fear that is there, because you don't know anything. You don't know what they stand for. You don't know what their goals for you are. You have no idea what their for instance, C-section rates are. You don't have no clue. And so there's a innate fear that's there. So there's this almost semi-innate trust that then happens, because you're like, I hope that they do right by me, but you don't know. You don't feel good about it. You don't have the good feels. Sometimes people feel like they trust a hospital system and not the people taking care of them. And I would combat that. Hospital systems stick around for a very, very long time. The people in there working do not. And the care changes over time, because it's all based on who's working there. Hospital systems don't do, in my opinion, an amazing job of providing very individualized care, and that's a very generic statement, so that's not going to be the same across the board. Like, there are big hospital systems, like where I went for residency, that I think does provide good individualized care, but as a whole, like, it's hard for them to do that, because you are just another number in that case, speaking of just the system, right? But when you talk about, you go into the nitty gritty of like the OBGYN department, and now you've been in there and you've seen all of the providers there, and you feel very comfortable getting care from all of the providers that are at that place. Now that's different, right? It's not the system taking care of you. It's the people in that department, those specific providers, the nurse practitioners, the midwives, the PAs, the doctors taking care of you, now that you trust. You're not trusting the system, you're trusting the people. And I think that that's what's more important. So it's all about trust. To me, hands down, all about trust. Use a birth plan to figure out if you trust folks to help you do the things that you want to do, and to be able to pivot. And when you pivot, to be able to trust then the process after that. There's this term that's trust the process. And so you have to trust this process when it comes to delivery, because babies come out however they want to come out, and they don't always do it the way you want it to happen, right? A birth plan says it must happen this way, and it must go in this order, A, B, C, D, E, F, G. Well, the problem is babies don't always like that. They do whatever they want, and they don't like your order. They don't even care. They don't care about none of that. So the key is you got to be able to trust that when you now have to pivot, that now that provider still has your best interest at heart and then can help you do those things. As a support person, when you are trying to advocate for someone and you want to just support somebody and you're like, what should I do to do that? Number one, you got to understand your loved one, what they want. What is their ultimate goal? Not the nitty gritty, but their ultimate goal, right? I always tell people my goal when I take care of pregnant women is I want them to have their child and leave it at a hospital, that baby in their arms or in the car seat, in their lap, being wheeled out on great terms. And without the baby needing to go to the NICU and without mom needing to go to the ICU. That's my goal for every single pregnant mom I take care of. That's my goal, ultimate goal. So everything I do is geared towards that. As a support person, what you can do is, a great thing to do is learn to ask questions on things you don't understand. If you're in a hospital and someone says, hey, we want to start Pitocin on you, a good question to ask is, how do you think this is going to help her labor? Right? That's not a combative question. That's a great question. How do you think it's going to help? Well, looks like her contractions have stalled out. I think Pitocin will help get the train moving again and get it moving a little bit quicker to kind of help have a baby. Sometimes the interventions we use on labor and delivery are all about speed. We're trying to get the baby out a little bit faster than what is happening. And some of that is we're trying to beat the clock. The clock meaning if you labored for a week, 2 weeks, ultimately something bad can happen. Probably will happen. And so we're trying to get the baby out before a bad thing starts to happen. So that's why speed can be very important. The faster the baby comes out, the less likely some craziness is going to develop. An infection, crazy bleeding, the baby's not tolerating labor, so many different things. So sometimes speed matters, and that's why we sometimes do things to help speed up the process, to help keep the ball rolling. Because if your momentum stops while you're in labor, sometimes it stops for a very long time, and then we can't get labor to progress, and then that's why people have C-sections for failure to progress. Is actually the number one reason why a lot of women have C-sections, especially with the first baby, because we can't get their labor to just keep going forward. So that's why we do things in succession to help get things going. We're not trying to just get you out so we can get the room and clean it and get another person in there. I mean, we don't care. As individuals, we don't care. The hospital system cares, but as an individual, that's not our goal, right? So that's why I say the system not always has your best interest at heart, but the individual does, okay? And then the last thing is that, I talked about being that support person, helping somebody, being an advocate for them. Again, your goal is not to constantly fight, right? We are not trying to hurt your family member. That is not the goal. We don't do that. I'm going to speak with a lot of people. I'm going to get a generalized statement, but our goal is not to fight you. We want to work with you. We want you to trust us. We want you to come back. We want you to have more babies with us. So that's ultimately what we want. And I'm saying we as in like providers for me, for instance, pregnant women, but it could be for your grandmother. It could be for your aunt. It could be for a person with cancer, whatever that thing is, always ask questions. No, you are not a medical provider, or if you are a medical provider, you may not know specifically what's happening in that field, but it's good to be able to ask questions. And you don't want to ask it in a condescending way to be like, how could you do such a thing? But more in an inquisitive manner, right? Because you want to understand what's happening with their care. You want to understand that the decision that provider made makes sense to you, and it's going to help improve the outcomes for your loved one. That's the goal, okay? So ultimately, at the end of the day, if I could impress upon you anything, the goal is you don't want to fight your provider. You want to work with. You want to trust them. You want to do the things that you can to help their care, and then help your loved one do great and be better. And so sometimes that is leaving that provider and moving to somebody else. And sometimes that is just asking a little bit more questions, and that's all you need. So thank you again for tuning in. Again, my name is Dr. A.N. Hunter, and follow me, like, subscribe, share, and follow me for more. Thank you.